Hello, I'm Dr. Fan Wan. I'm a ventilation engineer and aerodynamicist. I would like to present you a short talk about the advice drawn from a large amount of research recently regarding to COVID-19 in the area of ventilation in a communal indoor spaces. I'm going to cover three areas. The first is foundation of room ventilation, basically suggested by CPC as a guide for professionals and building managers. Now, the second one is give you some findings related to COVID and room ventilation. And based on these two, I would like to give you some simple advice for people who living in shared spaces like student residence and shared flats. The basis for room ventilation can be seen as using simple, common indoor contaminants like carbon dioxide or moisture. Both are from occupants. Now, how do we quantify those indoor contaminants? Have already been well established. So basically, we use two variables. One is generation rate of those indoor contaminants, and the other is the concentration of these two in an enclosed space. And then we can use this to study how they transmit from one place to another. To control these two variables, concentration or generation rate can be done through either the occupants numbers and or ventilation or fresh air supply. And then from medical studies, we can to check how those contaminants affect occupants' health. So they are all well established. For example, if we focus on carbon dioxide, we have defined very accurately, very well defined concentration is the how many parts per million. Okay, and then based on large amount of studies, we correlate the concentration level of carbon dioxide with people's health effect. So this table shows you the levels associated with human occupant responses. Now, based on these studies, CPC, as well as ASHRAE and some other organizations, suggest that the normal acceptable level of indoor carbon dioxide level is 1000 ppm. So that gives you a clear guidance. And if the level goes high, then either you have to short your exposure, short your stay in that space, or you have to do something else. Then also, CPC and ASHRAE, they give the advice of how many people are allowed in an enclosed space, and also suggest the ventilation level. So here we have this illustration showing in a space the relationship between generation rate, concentration level, and the ventilation rate. So a generic formula is like this. The concentration C is dependent of generation rate, obviously, and the ventilation rate, and also how long it happens. To simplify this, if for stabilized indoor space, the indoor concentration level is proportional to generation rate and reversely proportional to the ventilation rate. Give you an example. If a room has one person and then he or she generates so much carbon dioxide. And then if that generation is full of contaminated by the carbon dioxide, and then we can do the calculation. So if the allowance, the threshold for that space is 1000 ppm, and then outdoor is clean but still contain 400 ppm, then if you use outdoor to remove indoor, so the ventilation rate is liter per second Q, and then G is the generation rate of the person, and we assume it's very effective, so efficient rate is 1, and then we can use the calculation very quickly. Tells us that in order to maintain indoor concentration lower than 1000, the ventilation rate should be 9 liters per second. But in the event of COVID-19, we have difficulty. Number one is we don't know how much is the generation of coronavirus. And also we don't know what concentration level will present a risk to an occupant. So the G and the C are all unknown. This is a dilemma. This is a challenge to room ventilation engineers. Study so far has tried to answer these two questions. One, what is the most common way of transmission of the virus from sick person, a patient, to a healthy person? And then how to quantify the risk. Just like what I explained earlier, the concentration level of carbon dioxide has been very well quantified and very well known. And to answer these two questions, need a good collaboration across multidisciplines like virology, public health, infectious disease, mental health, environmental health and science, and many others. And for me here, as an aerodynamicist and a building service engineer, I would like to focus at room ventilation. Actually, in very early on this year, we know there's something very big problem, and it's an outbreak of like a pneumonia from China. But this being somehow overlooked in many countries. So we have already known that transmission is between people in close contact. Now, how close? We will find out. The other is transmission by particles staying in the air over times and over distance. And how long, how much is another issue, uncertain. Third one is because of the particles from a person, a patient, traveling in the air and fall onto surfaces like desks and other, can be passed on to another person who touched that surface. The fourth one is the virus also found in some other human secretions. So therefore, that makes it even more difficult to determine the transmission. One relevant to this is in a shared toilet and a shared kitchen and so on. Risk transmission is very much depends on exposure to that virus. Then exposure is also a dependent of the type of the virus, duration of the exposure, and also intensity of the media you're exposed to. Now, the last one is the protection of yourself. Very interestingly, we found that large amount of evidence shows that infection is because of household contact in a crowded indoor spaces, like cruise ships. Early on, we have a very bad one in a cruise near Japan. And we also have ambient evidence about infection from house parties, buses, and so on, restaurants. So basically, we have numerous reports on cases found associated with gatherings in close contact, particularly in an enclosed space. So we, based on studies, how do we prevent in indoor space through ventilation? It is still a big challenge to building service engineers. One major alert to us is that we again had a lot of evidence showing that a person who do not have COVID coronavirus symptoms can still carry and pass that virus. So one study actually was published in April and the other in June as two examples. Now recently, we also found that although we have more than 700 cases test positive, but only 10% display symptoms. So that all this evidence suggests you someone look healthy can be carrying coronavirus and can pass that to someone else as well. Now let's look at the physics of these particles. Obviously, the virus are very, very small. Now the carriers, those droplets from your breath and aerosols are much bigger. So one such kind of particles carrying virus can be like from 1 microns to 100. But the viruses are much, much smaller. So that means one droplet or one particle or one aerosol can carry many. But how many, we don't know. If we do know a particle carries some virus, and then the physics of its traveling is pretty well, very well known. It's like classic mechanics or aerodynamics. So for a smaller one, like the one on the left, is smaller than 10 microns, can flow in the air for a pretty long time. So stay in the air for more than 4 hours. And the other one is slightly bigger, so they will drop, but still travel a distance. The bigger one, like a big droplets, will fall onto a surface or ground very quickly, within 1 meter or so. Bear this in mind. Bear this in mind. Now let's look at one cough or one sneeze, or just normal talking. How many particles and what the sizes are? These actually has been again well studied a few years before. So here what we can see is that a normal cough can create more than 1,000 particles in size of 10 microns. Some bigger, even much larger, will be 10 or so. Now, there's also a smaller one again. So there's a kind of distribution. So that's cough. Sneeze, much more, much more. So therefore, that shows you how many particles can be produced by one cough, or by one sneeze, or by normal talking. Now, singing, obviously singing is banned even in worship, because of singing produce the equivalent amount of particles like sneeze, all right? particularly these opera singers, they can produce a lot. Okay, anyway, let's go. Early studies in China, that is, last year, they have studied this, use this kind of visualization to show a normal breath or cough, how much particles in different sizes coming out, and then the path, how they distribute in the air. So they are in the air, those particles. They are in the air. If we focus at the troubles of different sizes, you will find, actually, as I said earlier, the bigger ones fall very quickly within 1 to 1.5 meters. And then the medium size will travel a little further, and the smaller one will remain and travel even longer. So majority, the bigger ones, carry more viruses, are falling in, between 1 and 2 meters. So that is why we have said, early on, such as social distance is between 1 and 2 meters. So that shows you more clearly the sizes and the distance. Okay, so we have here falling, from 2 meters height, and then drop to a 1 meter from here, horizontal, and 4 meters. So you can see larger one falls very quickly, medium one falls around 2 meters, and then this longer, slightly longer. And there's a concentration. If in this kind of light come this area, it'll be more concentrated. So you can see small particles can travel and deposit on the face of the other person standing within 1.5 meters. So therefore, that is why you need to stay, in 2 meters distance. Now, application of this is, if you sit across opposite of the dining table with someone, with a patient, you definitely will get infection. So that is why going to bars and the restaurants, you need to be very, very careful. So that is another illustration showing the contaminated surfaces. So washing hand, obviously, is very important because those surfaces contaminated by droplets from a patient contains a lot of viruses, right? And then the touch can carry it, pass it by to health person. And when you touch your face, eyes, and nose, then you get infected to your respiratory systems. Okay, now, based on what we just explained, washing your hands very often is crucially important, and also wash the surfaces in, for example, shared a kitchen, the desktop, and then the washing hand brush, the taps, right? You need to wash those regularly, and the face covering. The face covering have been very controversial, and it's very difficult to understand this, why, cross culture is so different. In Oriental culture, it's so easy to accept this face covering, but in Western society, it's so difficult. Now, again, avoiding crowd spaces. So 3 major advice. In public media, BBC is considered the most reliable ones, but early in March, this doctor says the virus is not flowing in the air, which now we find is very wrong. Right? Even I said early on, it is in the air. All the virus is carried by the droplets and then aerosols. They are in the air. And we also have a device in March saying face mask is useless. To summarize the study is that you have a patient, his breath or talk or coughing or sneezing can all spread the droplets, aerosols, those particles carrying virus if he's a patient. Now, if someone standing close by, the air surrounding him carrying those virus, those droplets, and the bigger one droplets which on his face and smaller being inhaled into his lungs. Now, protection is to cover the patients, so therefore there's less traveling space, less area being contaminated by his breath. And the other one can protect himself further by wearing a mask himself. Very simple. The co-director of that research I showed you earlier, the mask effect of mask, actually, he published this study in early April. So he says why the government didn't advise people to wear masks is because they were not enough supply. So they won't ensure medical people have enough to use. Now let's summarize, give you some kind of quantified protection effect. The base case is that one patient and one receiver, they don't wear a mask and they stand within 1 meter also. And then infection rate is 100%. If we define this as 100%, then if the health person wear a mask herself, then that infection rate reduces to 70%. So therefore 30% reduction. However, if the patient cover herself up, that reduction will be 95%. So therefore, wear a face mask is to protect others. You don't know if you carry virus. So therefore, put it on if you can, particularly in an enclosed space. I'll explain this further later. If we both put it on entire society, then the transmission rate will be further reduced to 1.5%. Now, let's see some other events. During the June in the United States, we have seen a lot of big campaigns, a lot of people gathered and shouting slogans without face covers. Then you can imagine what happens. However, we don't have any related studies. How many cases, how many people being infected? We don't. But if you look at the statistics, here is the daily cases in the United States. And if we look at the 3 red bars, these are the 3 biggest events in the United States. And then 2 weeks after, you can see that raises. I don't know if that raise is directly related to those big events, outdoor demonstrate protests. I don't know. But anyway, be careful. However, there are some absurd events like this. Even in September in Edinburgh, a place people claim to be the place for enlightenment. We still have people saying this. They don't like masks. They don't like social distancing. And even they don't like vaccine. So my advice is simple. Stay away from those guys who do not follow governmental regulations. There's another example showing why you should try to avoid as much as you can going to bars, restaurants. This is a study carried out in early February. What you see is a simulation scenario in which a patient escaped from Wuhan, the center of pandemic, traveling over 1,000 kilometers to Guangzhou and celebrate his escape with his friend in Guangzhou in this restaurant. This is the patient, and then very soon, his friends, 3 of his friends were tested positive and admitted to hospital. And then, by the study started, another 3 in near table and another 2 another table were tested positive and admitted to hospitals. Now you can see that patient spread virus through his talk, release the particles, droplets, aerosols, and they flowing in the air, blow by the supply air, and then contaminated downstream. So this 3 person gets infected. And because this system is recirculation, so the air going backwards, and this 2 also infected. So therefore, in this kind of room recirculating system, it's very poor. It's very risky, and you should avoid this. And recently, because of new regulation, CPC, they advise the restaurants, bars need to have 100% fresh air, not recirculating. Another example, again based on real case, that is study in a coach. That shows you why you should wear a face covering in public transportation. So this is a bus, and the patient is sitting here, and then with one cough, 5 seconds after, these 2 rows being contaminated. 10 seconds, another 2 contaminated. 40 seconds, filled with those particles. This is with normal breath, 5 seconds, only travel a short distance, and then 10 seconds, and then 40 seconds. So normal breath can still contaminate a large area. And these are all without face covering. So therefore, cover your face before you go on board a public bus or other transportations. In a shared kitchen, what you can do is you need to wash as often as you can. If this is a patient, then his breath will contaminate the surfaces here. Worktop, sink, and most often touched is this tab. So therefore, clean those worktop and clean all the surfaces as often as you can. and wash your hands. Now let's see what you should do. You must do in a shared toilet or in a public toilet. As I mentioned earlier, virus not only carried by the particles, aerosols from your breath, but also by other human secretions, stools, for example. So therefore, it's crucially important when you flush, you need to cover the lid. So here we have two examples of comparison. This is with lid open, and the flash will activate, will allow those particles to escape out of the toilet and going up into the space. With the lid covered, then you don't see too much. So that is 17 seconds. Now, if we wait another few seconds, 24 seconds, you will see more particles jump out of this toilet into the air. And then this is with lid cover, so you don't see much. And that is another few seconds into 30 seconds after the flash. You can see more and more, and that is 54 seconds. And these particles will eventually deposit on surfaces and even breathed by yourself. Obviously, if you are a patient, then no problem. But those deposited on surfaces, and then another person coming in, use this toilet, can be risk. So therefore, again, it's not normal etiquette, not normal etiquette, social etiquette, but it is essential to protect others, right? Protect others. I have been following the daily cases, statistics in Lothian area for a long time. So you can see in the early April, we had a very bad time. And then we have a very successful, reduction. Now, in September, we have a rapid increase. That is coincidence with the opening of universities. People leave homes and then go to university, meet people, celebrate, have parties, and that's the results. Now, if we see this increase, now we reach daily 6,000 in the entire country. And if we don't do anything, this 6,000 will go up to 50,000 a day. 50,000 a day. That would be a disaster. So let's do something about it. Recently, last week, we have again outbreak in number of universities. This is one of those, and it's quite worrying about people's view, particularly young people. How do they view the current situation? So this girl says she doesn't think people were too wildly unsensible, even there is such kind of outbreak. Anyway, we in this kind of special, extraordinary situations, we just have to see things more seriously, and we have to change our behavior. It is a big killer. These two photos I took from early March. Those urns in one of the 7 major large crematorium in Wuhan, the center pandemic. And they run out of those urns because there was too many bodies to burn, and then relatives waiting hours outside the crematorium waiting to collect the ashes of their beloved ones. Yes, young people are stronger. Although they get infected, probably don't develop symptoms. Even if they develop symptoms, someone may feel uncomfortable, but they can probably still survive. But if you are old people, weak people, you probably won't be so lucky. So therefore, follow the government restriction advice, follow those regulations to protect others. To summarize, transmission primarily from breath, the air from your mouth, and the larger ones follow onto surfaces. So therefore, you contact the surfaces, you need to wash your hands. So wash your hands is really important. Those smaller ones can travel and then landed on your face. So therefore, stay away at least 2 meters. Then those smaller ones will remain in the air for a long time. Therefore, you need a face mask, particularly patient. And even those without the patients, because you don't know. So therefore, not only a social etiquette, but just a social responsibility. You protect others and protect yourselves. So therefore, face masking, face shielding, in a ventilated spaces, ventilate your shared spaces as often as possible. Now, in winter time, open windows for the ventilation can result in low temperature. Therefore, you need to wear more clothes to keep warmth. Otherwise, you have to heat the rooms and you end up spending more heating bill. Then, social distance, because the droplets, right, they can travel to up to 2 meters about. So therefore, keep a good social distance. Then washing your hands. Now, to avoid face-to-face meeting across the household during the pandemic, keep a distance and keep your shared space ventilated as much as you can by simply open windows more often. And during the winter time, obviously, you need to wear more clothes because open windows means you lost heat. Now, wear a mask whenever you go to public space, supermarket, buying things, and public transportation. We need to work collectively. We have to sacrifice some of our personal preference for public good. And also, I strongly advise you download NHS Scotland, the track and the trace and track. So it is a good way to protect collectively the general public and the nation. I'm going to summarize my talk by this illustration. A bucket is made to hold water as much as it can, but the water level depends on the shortest one. If you have an individual short of a full length, that will set the entire level of this bucket. So therefore, let's be a full length of this element and then follow the rules, regulations of the society so we can have a full level of water in this bucket. Stay safe, be well.